Hello, everyone. Welcome. We are going to give it a moment to let people sign on. I see our number rising. Thanks for joining today. Give it another 30 seconds or so. All right, we'll get started with some housekeeping items. Hello, everyone. Thank you so much for joining us today. This has been a popular topic requested, and I'm excited that we're able to bring this to you today. My name is Mary Kate Wells. I'm the program director at the National Council on Independent Living, and I help coordinate the logistics for these events. And I just wanted to welcome you to our latest webinar on financial risk mitigation. Today's presentation, and Jenny, are you able to share the screen? Thank you. Today's presentation is brought to you by the Administration for Community Living at the United States Department of Health and Human Services in conjunction with the ILNet. ILNet is operated by IRLU with collaboration with Nickel, April, and the University of Montana. So could you go next slide? The next one. One more. There we go. We on the screen is the logos of each of those organizations. And for those that have been joining these type of webinars for many years, you'll notice that we have a new format on the screen. We now have the English text on the left and the Spanish text on the right. So giving you a visual description of myself, and my pronouns are she, her. I'm a white female with short reddish hair, wearing a white shirt and a pink scarf. Some housekeeping items. So captions are available today. So if you click show subtitle in your Zoom menu and click them to turn on, we also will have captions running through AI Media. And the link will be shared in the chat box. In AI Media, you'll be able to enlarge the font and also change color and contrast of the captioning. We have ASL interpreters present today and should always be visible in gallery view. Please let me know if you cannot see the interpreters at any time. In addition, we have Spanish translation available. In order to access that, you can go to the Zoom bar on your screen and choose the language that you would like to hear the presentation in. We will be reading all the content on the slides and all questions out loud so that it would be available to individuals calling in the phone or can't see the visual content. Public chat is turned off, but you are able to chat with the panelists. We ask that you reserve the chat for requests for technical assistance, and please submit your questions in the Q&A feature. And so speaking of questions, we have saved can't see, sorry, I'm just looking at the chat, can't see translator. So if you're looking for the Spanish translation, you can click it at the bottom of your screen. Awesome. We anticipate that you all have a lot of questions today, so we saved a good amount of time at the end of the training to answer those questions. Please
hold on 1 second, Mary Kate.
Okay.
The ASL interpreter or the Spanish translator? Pilar. And I can unmute you if that would help.
I only see the screenshot and just a little logo, nothing else.
Okay, you cannot see the ASL interpreter?
No.
Okay, hold on one second.
Are you on a phone or a?
Yeah, I could see you all now.
Okay. Are you on a phone by
I
any
am.
chance?
Mm-hmm.
Can you swipe? So if I share the screen again, can you just swipe to the left? So your
No.
entire thing, that doesn't help?
No, I'm trying like sideways and everything. I mean, it's fine with me, but I'm just letting you
No,
know.
that's
because-
good to know. Thank you.
Mhm.
If anybody else does have problems, please just type it in the chat if you are unable to swipe either direction, and we can get that figured out.
Yep. Awesome. Okay. Yep, and just let the host and panelists know that in the chat. So today, to just finish off some of our housekeeping, you can submit your questions in the INR, the question and answer box, and our presenters may answer questions along the way if they feel it's relevant to the current slide and can be quickly answered. If you're on Zoom, you can simply type your questions in the Q&A box. You're also welcome to email me at mary-kate@ncil.org. And I will provide my email in the chat if that's more accessible to you. And also, if you're on the phone today, you can press *9 to indicate that you have a question. When you're selected on, we will ask you to press *6 to unmute. Okay. Finally, we asked that you could complete our evaluation survey today. So Jenny, can you go next slide? We use these surveys to generate these topics. So we heard you during the August quarterly Connect call, and in your evaluations, it kind of resulted in this webinar. So we hear you in your evaluations, and we appreciate you taking some time to complete those. Next slide. Okay. So our topic today is financial risk management, and we hope that you will learn today what indirect costs are, including an introductions to the regulations, what indirect cost methods are available and how to decide which ones to use, how to charge indirect costs and how to get started, and how to continue charging indirect costs long-term. And finally, cost allowability reminders and best practices. So with that, I'm going to hand it off to our speaker today, Erin Taylor, who is a Supervisory Grants Management Specialist at ACL. And I will hand it off to you, Erin.
Good afternoon, everyone. I'm excited to be back from August and looking forward to the discussion today. As Mary Kate said, I'm a Supervisory Grants Management Specialist. I think we need to go back one slide. And I work in ACL's Office of Fiscal Operations. I'm going to be leading us through this discussion today. We wanted to start off by sharing a reminder, and that is when it comes to uniform guidance, we use 45 CFR 75. This is Health and Human Services, or HHS's version of 2 CFR 200. It says specifically on the screen, the Department of Health and Human Services, HHS grant recipients, including those that get funding from the Administration for Community Living, must comply with the administrative requirements, cost principles, and audit requirements that govern federal monies associated with an award. As applicable in the uniform guidance, and in HHS, we use 45 CFR 75. There's a link provided on the slide that will go out when materials are shared. Next slide, please. So this slide goes over why do we have 45 CFR 75? Why don't we just use 2 CFR 200? HHS uses a separate version of the uniform guidance. I will speak up. Thanks for Thanks for putting that message in the comment. HHS uses a separate version of the uniform guidance in order to manage its diverse grant portfolio. HHS makes a lot of investment in research and in direct patient care grants. And this portfolio is different than a lot of the grants that are managed under 2 CFR 200. Many of the subsections within 45 CFR 75 are the same, but there are some nuances. And in our discussion today on indirect cost, we'll go over a few of those nuances. As an update, HHS is working to further align with 2 CFR 200. A recent update that went through on 45 CFR 75 was adapting the closeout requirements that are in 2 CFR 200. I've had several discussions with designated state entities in the past couple of weeks because our old awards used a 90-day liquidation period for closeout, and new awards are using the 2 CFR standard of 120 days. So it's been causing some issues because the states are used to having an extra 30 days for liquidation, and we have to do an extra process to make up for that. Next slide, please.
And I'm sorry, Aaron, this is Mary Kate. Would you be able to move your speaker or like your microphone? Some people are still saying it's a little quiet.
All right. I will try my best.
Oh, that's better. Yeah.
And I'll aim to speak up more as well.
Thank you.
Okay. So a lot of today's discussion is about indirect cost. The indirect cost definition in 45 CFR 75.2 is as follows. Indirect, or facilities and administration cost, means cost incurred for a common or joint purpose benefiting more than one cost objective and not readily assignable to the cost objectives specifically benefited without effort disproportionate to the results achieved. That's a mouthful. So on the next slide, we wanted to bring it into more common terms. So in basic terms, indirect costs represent the expenses of doing business that are not readily identified with a particular grant, contract, project, function, or activity. They're necessary for the general operation of the organization and the scope of the activities it performs. Generally, a cost can be indirect or direct cost. If you're able to identify your direct cost, then any costs remaining are indirect cost. Next slide, please. 45 CFR 75, 414 subpart B provides some common examples of indirect cost for nonprofits. They list out the examples including depreciation on buildings and equipment, the cost of operating and maintaining facilities, and general administration and general expenses, including salaries and expenses of executive officers, personnel administration, and accounting. As we go through today's discussion, you will understand that indirect costs are unique to the organization and how the organization does business and sets up its accounting. So these are common general examples, but they might not be applicable in your own situation. Next slide. Over the next couple slides, we are going to hit on all of the key regulations for indirect cost. They're primarily housed in 45 CFR 75.414. Within the subsections of this regulation, we go through the key components of indirect costs, and it also provides a guide to the appendices. I'm going to read through each bullet to identify the regulations and provide them as a clean reference. And as we go through the remainder of today's discussion, we will we'll come back and make connections to these regulations that I'm introducing. The guidance on obtaining and using a negotiated indirect cost rate, including charging caps or exclusions, is provided at 45 CFR 75 414 subpart C. The information on applicable appendices to obtain guidance on a negotiated indirect cost rate for Centers for Independent Living, and these are for nonprofits, is at Appendix Roman numeral 4 to Part 75. So this is an appendices on 45 CFR 75. The appendices is called indirect or F&A cost, identification and assignment, and rate determination for nonprofit organizations. The F&A acronym is for facilities and administration. This is a common indirect cost component in universities. Because HHS makes grants to lots of universities and higher education institutions, it includes F&A or facilities and administration, often in its discussions of indirect cost. Next slide, please. We're going to continue to work through these regulations. The guidance and parameters on using the 10% de minimis indirect cost rates are identified in 45 CFR 75 414 F. The guidance on a one-time extension of your negotiated indirect cost are in 45 CFR 75 414 G. Next slide, please. All right, so we are going to go ahead and jump into a more detailed discussion of indirect costs and the different types of rates that you can utilize. The primary types you can utilize are first, negotiated indirect cost rate. You can learn about negotiated indirect cost rate regulations at 45 CFR 75 414 C and subpart E. You can also get additional information in that appendices 4 to 45 CFR 75. We have all of this detailed out on the slides and links as applicable. Next slide, please. The 10% de minimis indirect cost rate is discussed at regulation 45 CFR 75 414 subpart F. A lot of CILs use the de minimis 10%. It's very important to know this regulation. It's only about 4 sentences long, but it has some key information. Next slide, please. One important notation to make for 45 CFR 75 compared to 2 CFR 200 is around the de minimis cost rate regulation. Under 45 CFR 75, a federal grantee cannot use the 10% de minimis indirect cost rate method if they have previously had a negotiated indirect cost rate. This is different than the requirement stated in 2 CFR 200. If you are working a ward under 2 CFR 200, you would be able to take the de minimis indirect cost rate, even if you had a negotiated indirect cost rate in the past. Earlier in the slides, I said that HHS is working to adopt more of 2 CFR 200 into 4575. I have not heard about updates or changes to this subpart. Next slide, please. If you are interested in obtaining a negotiated indirect cost rate, the first thing you need to do is determine your cognizant federal agency. For most grantees, the cognizant federal agency is the agency that provides your largest amount of grant funding. I know for many CILs, This would mean that your cognizant agency is HHS. If you elect to obtain a negotiated indirect cost rate, then you need to work with the applicable office within your cognizant agency. Next slide, please. If your cognizant agency for indirect cost rate review is Health and Human Services, then you should be working with the Program Support Center, or PSC. It's the applicable office for conducting negotiated indirect cost rate reviews for all HHS grantees. PSC also serves as the review office for several other federal agencies. When I was working at the Housing and Urban Development, we used PSC as our office for reviewing indirect cost rates. This is important to know, PSC, because ACL staff, the staff that you work with every day in the Office of Independent Living program, or if you reach out to myself and others on my team, we have no authority to accept an indirect cost rate application or issue approval for a negotiated indirect cost rate. If you reach out to us for guidance on the status of your negotiated indirect cost rate, where to submit your application, we will direct you to the Program Support Center.
And Aaron, I just wanted to jump in and reinforce that the ACL staff cannot approve your rate. Period. They can't track it. You've got to go to a different agency for that. And just remember that as we go through it. And you may contact me and I'll help you go through it, but your program managers can.
Thanks for adding on to that point, Paula, because it's a question we get often. I work with all of the ACL formula grant programs issued under the Administration on Disability, plus several other grant programs, and it's a very common misunderstanding. Next slide, please. All right. If we haven't hammered it home enough already, PSC delivers the negotiated indirect cost rate approvals. This includes both final rates and provisional rates, and they deliver that in a letter format to the individual organization that submitted it. Your PSC approval letter permits you as a federal grantee to charge indirect cost to active awards. Let's talk about the approval letter. The approval letter should be shared with federal agencies as directed. If you are applying to discretionary programs or competitive grant programs, they often require you to submit this as part of your application. Under the Part C program, we don't require submission of it, but if we were to request it in response to a review of a financial report or as part of a comp evaluation or technical assistance review, then you should be able to provide it as support for any indirect cost charging. Next slide, please. All right. So some of you might be sitting out there and wondering, why should I apply for a negotiated indirect cost rate, particularly if you have been successfully using the 10% de minimis rate. Some of the reasons you'd like to, or some of the reasons you may think about moving forward with it include an approved plan will clearly outline your accounting system and distribution of direct and indirect cost. By completing the application for a negotiated indirect cost rate, you will have done all the front end legwork to lay out the internal controls, to lay out your accounting system setup, and to break down your financial data. Then you will have a clear map in which to apply a rate, and you can apply it confidently. You'll have that approved plan that'll explain the methodology for charging indirect cost, and it'll specify any limitations or any special circumstances in which you may or may not be able to apply the rate. Next slide, please. Also, the approved plan will provide a specific time frame, in which the indirect cost charging is permissible, and it will state the expectations for recertification or renewal of a negotiated indirect cost rate. And probably the biggest reason is that in most instances, an approved plan will likely permit you to charge a rate that's higher than 10%. Next slide. We're going to turn our discussion now to the 10% de minimis indirect cost rate. When I review SIL-based financial reports, this is the most common version of indirect cost that I see. The 10% de minimis cost rate is available to federal grantees, including nonprofit organizations like SILs that choose not to apply and submit for a plan for a negotiated indirect cost rate. To charge the 10% de minimis indirect cost rate, you must have a clear understanding of your cost. You need to be able to identify a direct cost and an indirect cost and be able to consistently apply that charging method. What this means is that even though you're using the 10% de minimis indirect cost rate and you chose not to do a negotiated indirect cost rate application, you still need to have strong accounting setup. You still need to have a plan and understanding of your cost, and you need to be able to apply the 10% indirect cost rate consistently across all of your federal awards. Next slide, please. I share the emphasis on the importance of having the accounting system set up, the internal control set up, and having all of your policies and procedures in place when using the 10% de minimis, because I have heard comments in the past in my grants work that grantees might choose the 10% de minimis because it's easier and they don't have to go through the negotiated indirect cost rate application process. I would say that either way, de minimis or negotiated rate, you still need to have the same foundations in place, and you need to have a strong system of controls and processes within your organization to ensure that indirect costs are properly charged.
Yeah, and Aaron, I might just jump in here. There are strings attached to the 10%. It isn't just a flat 10%. And he's detailed that here, but look at it closely. Those of you who are using a 10%, are you applying it against modified total direct costs, not all of your direct costs? Because there are strings attached and limitations to the 10%. We're not going to go through a lot of detail there, but just know that it isn't a flat 10%. And if you are applying it as a flat 10% against all costs, we need to talk.
Really good point, Paula. And we have an example coming up to talk about that. I think this is an important nuance that gets missed a lot. It's exciting to have this opportunity to get an extra 10% in to help cover overhead or back of office costs for your organization, really just to offset operations. But the regulations require you to be very intentional about how you utilize the 10%. So moving into this further, as Paula just mentioned, you take 10% of the modified total direct cost. This acronym is MTDC. You do not apply the 10% de minimis against the award amount. The MTDC definition, or modified total direct cost definition, in 4575 states that the MTDC are all direct salaries and wages, applicable fringe benefits, materials and supplies, services, travel, and up to the first 25% of each grant subaward, regardless of the performance period of the subawards under the grant award. This $25,000 of the first $25,000 of the subaward is a really important component in calculating your modified total direct cost. Because for that one contract, once you go over $25,000, then anything over 25K is not part of the MTDC, right? So the last bullet talks about MTDC exclusions, which include equipment, capital expenditures, charges for patient care, rental cost, tuition remission, scholarships and fellowships, participant support cost, and the portion of each subaward in excess of $25,000. So before you even start using that 10%, you need to know, what are my direct costs and how do I calculate my modified total direct cost base? When we get to our discussion of SF 425 or federal financial report reporting in box 11, we will go over where you insert that MTDC amount. Next slide, please. We like to really emphasize some of these key requirements. And the first bullet here hits it home again, which is grantees must apply the 10% diminished cost rate against the modified total direct cost, not against the award. We have seen this mistake in the federal financial reports or SF 425 submissions, that federal grantees are calculating their 10% based on the grant award amount and not actually the modified total direct cost. It's not just a SIL mistake. This is a mistake for other grantee communities that we have. Next slide, please. To take this common mistake and put it into real numbers, in the incorrect application, a federal grant award was received of $330,000. The grantee calculated indirect cost as $33,000. They did this by multiplying the federal grant award $330,000 times 10%. This is the incorrect method because the federal grant award, $330,000, is not the MTDC, right? So in this instance, the grantee has calculated an indirect cost amount that exceeds what's permissible under the regulation. To do this calculation properly, the correct application will use the same federal grant award amount of $330,000. We will calculate the maximum MTDC, which is $300,000. We do this by taking the federal grant award amount, $330,000, and dividing it by 1.10. So 1.10 is taking the digit 1 and adding 0.10 to it, because 0.10 equals 10%. The indirect cost from this calculation would be $30,000 because we took the modified total direct cost amount of $300,000 and multiplied it by 10%. So when we look at the incorrect example and the correct example, it's a difference of $3,000 in indirect cost. If you apply the 10% against the award amount, you would be taking $3,000 more than permitted under the regulation, and that would be considered a improper payment or a non-compliance issue. Next slide, please. So now that we've learned about negotiated indirect cost rate agreements and the second method, 10% de minimis indirect cost, how do you determine what to do? How do you determine where to start? The first thing you need to do is look internal and look in your house. You need to determine whether you have the accounting expertise, the system capability, and adequate internal controls to identify direct and indirect costs and to appropriately charge or appropriately apply an indirect cost rate. If you need to improve your capacity, your systems, or your controls, you should work with an accounting professional with federal indirect cost rate experience. If you are having an annual financial audit done, this is a discussion that you can have with your auditor. If you have a single audit done, this should be part of your discussion as well. Next slide, please. Once you have the bones in place, you have the systems, you have the processes, you have the policy, you have the staff, then you can apply for a negotiated indirect cost rate, or you can set up your accounting system and go ahead and implement the internal controls to start utilizing the 10% de minimis indirect cost rate. If you are applying for a negotiated indirect cost rate, you need to work with that applicable office at your cognizant agency. For many of you, this is the Program Support Center, PSC at HHS. You'll submit your application to them. You will await feedback. Sometimes this can be a lengthy process. You will address any questions they have and hopefully get that shiny, bright, exciting approval letter via email or mail. Once you have the approval letter for the negotiated indirect cost rate agreement, or once you have the accounting set up ready to do the de minimis, then number 3, last step, you can start charging indirect cost. Next slide, please. When working with PSC or the Program Support Center on your negotiated indirect cost rate, remember they're going to be the entity that you reach out to submit your plan, to obtain any extension, or to submit for renewal of an existing plan. On the slide, we have links to their key websites. Again, the materials will be shared. I will tell you there are 2 PSC websites. The first one is a landing page that gives you information on indirect cost. And that landing page has a link, which we've also provided the direct link to, that goes to all the contacts regionally for PSC relative to indirect cost rate. They recently updated this website in the last 3 months to give more information and direct context because originally they only had 2 individuals and their emails on the website. And I imagine those individuals were overwhelmed with correspondence.
Yeah, and Aaron, I would just like that. We have a couple of questions in the question and answer
Right.
that I think might be useful before we go past this topic. And the first one was about the MTDC and how it's calculated. And I'd
Yes.
like to direct everybody back to slide 24 for that. If it would be
Yeah.
okay to go back there real quickly.
And I appreciate it, Paula, because I'm trying to find the right way of stating it to meet all accessibility needs, right?
Well, and
Yeah.
well, it's a tough one because it's different from what people expected to see, right? And so it takes a little bit of thinking about it. But if all of you will take a look at slide 24 when you get back to your offices and you're working this through, that's what we'll look at along with what's on the website that is here on the slide that you see now. Okay.
Yeah, and I will tell you that ACL does not have a specific guidance document on this. If you search the internet on how to calculate MTDC, there is a lot of good credible documents. I don't have the ability to recommend one state's or one other, but I did review some state ones and they had some really great guidance and use this same type of calculation. Again, the key in the calculation, and this is assuming no exclusions, right? We went through all those exclusions where you would have to further deduct from your MTDC, but no exclusions. You would take 1 plus your indirect cost rate percentage. In the example, I used 10%, which also equals 0.0 or 0.10. So you do 1 plus 0.10, and that gives you 1.10. Then you take the grant award and divide it by 1.10, and that gives you your maximum MTDC.
And that could be addressed against both, every funding source. When you're looking at your indirect cost rate, you apply it against each funding source because that's its purpose, is to properly allocate the funds, the costs of your indirect expenses. So I hope that makes sense. As far as it going through it again, it's more complex than we have time for. So you will have my email in the chat. Please do contact me and reach out, and we will help with this because it's an important thing to do. We had a question that just popped up. Do you suggest calculating the MTDC while doing the budget? Absolutely, right? As long as you've got, if you're doing your 10%, if you're continuing with 10% rather than a negotiated rate, and you started there because you can't go backwards to 10%. If that's the case, then that's where you would do it. And also in your actual bill paying process, right? You're going to actually allocate your actual costs as you pay that bill. So you need to know what they are and how you're applying them. I don't know. Did I go in the woods too much, Aaron?
I think it's okay. And as we go through today's call, right, we talked about working with an accounting professional because they're going to be able to sit down with you. And if you have a financial auditor, someone who's doing that already, that's a great place to start. And you can make this part of your next discussion or next audit discussion or frame. I also see the question, can we see a sample of how this works within an accounting system? That goes a bit beyond the scope of today, right? I will speak to that from the standpoint of when you're doing indirect cost and getting ready to plan out your method for charging them, start on paper, right? And start at a high line amount. And you can make a simple line on the paper and say, on the left side, these are direct costs, and start marking them out. And on the right side, these are indirect costs and marking them out. When I look at a checkbook or a general ledger for a grantee and see charges, I will see specific charges or expenses for direct cost. And then we might see an allocation of indirect cost at the end of the month or the end of the quarter. And we know that indirect cost goes towards whatever the pool of cost or bucket of cost you've defined as indirect cost. The advantage of having a negotiated indirect cost rate agreement is that you have a plan that says what your indirect costs are, or it outlines the strategy for how you will define indirect cost. If you're using the de minimis, this is another expectation on you internally to have policies and procedures in place, have internal controls in place to outline your definition of direct versus indirect costs and how you apply it within your accounting system. Next slide, please. All right, so now we're going to shift to financial reporting. For every federal award you receive, you're required to submit a financial report. For awards issued by the Administration for Community Living, you complete your federal financial report or standard form 425 in the payment management system. Within the federal financial report, you complete indirect cost reporting in box 11. Box 11 has 6 components, A through F, and then a summation line item, or summation line called 11G. If you have multiple indirect cost rates during a period or a project period for an award, then there are multiple lines within box 11, and you can provide data for each of the rates and then give the total in box 11G. I did see a question in the chat that you submit an application to HHS for your indirect cost. I would encourage you to go to the Program Support Center website and click on the link for the regional contacts. That was included in today's presentation as well, and reach out specifically to your regional office. Those individuals will be able to give you the best response on PSC. If you continue to have issues, you're welcome to reach out to me, and I will try from the federal side to get some assistance as well. But please do use the regional contacts first. Next slide, please.
We are just going to switch over who is sharing screen. Beautiful.
Yeah, great. So on these slides, we're going to walk through each of those boxes within the federal financial report. I'm going to give a definition first, then we have a visual example that I'm going to walk everyone through. So we start in box 11. In box 11A, this is where you input your type of rate. There are 4 selections: provisional, predetermined, final, or fixed. Provisional and final apply to a negotiated indirect cost rate. Depending on the letter you receive from PSC or the other applicable office, if HHS is not your cognizant agency, you will have a determination of a provisional rate or a final rate. Based on that letter, you would select provisional or final in the box. If you're using the de minimis, I recommend doing a fixed rate selection for box 11A. I don't know what predetermined would be. I don't think it applies to the SIL community. Box 11B is the actual rate. So this is where you put in the numeric digit. If you're doing the de minimis, you would put in 10.0 or 10.0. If you have a rate that's different than de minimis, you would put in the numeric rate into this box. 11C is the date time frame for a negotiated indirect cost rate agreement. This would be the start date and the end date. Box 11C is not applicable if you're using the de minimis rate, because you don't have to have an agreement to use the de minimis rate. Next slide, please. So Audrey, that's a good question. We see in the Q&A that your SIL has a negotiated rate and you put it in the IDC or indirect cost part of box 11 in the FFR, and you had it sent back telling you to take it out. Not sure why that happened, but you're welcome to reach out to me directly. I can put my email into the chat to share. I would have to take a look at that individually and see what the circumstance is. I have 3 individuals on my staff that have different regions in support of doing the financial report work for the SILs, and I work directly with Region 5, which includes Ohio and Wisconsin and Indiana, Illinois, and Minnesota. One moment, and I'll put my email in the chat, and you're welcome to, follow up. And I put it in the large group chat. I don't see my email as proprietary information and work in public service, so it is available to the group. All right, continuing back on our discussion of financial reports, we had paused before at box 11C. That was where you put in your time frame. In box 11D, this is where you put in your direct cost base, which is also your modified total direct cost, your MTDC total. This is the total based on your expenditures to date on the award. So it wouldn't be your projected amount for the whole award. It would be based on how much you've expended so far. And your expenditures are included in box 10. 11E or box 11E is the cumulative amount of indirect cost charged against the award. So this would be the product of multiplying box 11B times 11D. And it basically says, based on your rate and your direct cost base, this is the maximum indirect cost you can charge the award. Box 11F is the actual indirect cost amount you're charging to this federal award. A lot of times box 11E and 11F will be the same, but 11F could be smaller than 11E. You will never have a circumstance in which the amount you enter into box 11F is greater than 11E, because 11E is the maximum indirect cost rate you can indirect cost amount you can charge on the award. I see there's a Q&A question. I'm going to go ahead and do the visual example on the FFR or SF425 before we go to that question. Next slide, please. So on the screen is a visual example of a SF425 or Federal Financial Report form. It's been cropped so you only see box 11. I'm going to walk you through the visual example. The first box you see is 11A. Again, this is where you choose your type of rate. We have 4 types we can choose from: provisional, predetermined, fixed, and final. In this example, we inputted provisional rate. So this sample organization has a negotiated indirect cost rate agreement. Box 11B is where you input the numeric rate. The numeric rate here is 25%. Box 11C is the period in which the rate is effective. There are 2 boxes to complete 11C. You complete the from date. In this case, that's October 1st, 2022. And the to date is September 30th, 2024. It's a 2-year period. In box 11D, this is the MTDC or direct cost base recorded on the award so far as a result of expenditures. The MTDC or direct cost base for this award example, based on the expenditures, is $80,000. Box 11E is the amount charged. So this is the amount of indirect cost, the maximum amount of indirect cost that you can charge to the award based on expenditures. And you calculate that by multiplying the rate, box 11B, by the base, box 11D. In this case, that's 25% or 0.25 times $80,000. And that gives us a maximum indirect cost charge amount of $20,000. So box 11E would be $20,000. The final box is box 11F. Sorry, I just took a moment to look at the question. I will answer that in just a moment. The final box is box 11F, and that is $20,000 as well. So in this case, the grantee in the example has determined that their maximum indirect cost rate charge amount is $20,000 in 11E, and that's the amount that they're going to apply towards the award and take as indirect cost. So in 11F, they've entered $20,000. So in the question and answer, we had a question of, does 11D, the direct cost base, equal 10E, right? So 10E, and we don't have a visual up for that. 10E is your federal expenditures to date. This is the grantee self-reporting. This is how many grant funds I have expended. In the Q&A, it asks, is 11D, your direct cost base, equal to 10E, your amount of expenditures? And the answer to that is actually 10E, your expenditures to date, would be the sum of 11D and 11F. Your expenditures would include all direct cost and all indirect cost. So again, the sum of adding 11D and 11F should equal 10E. I'm not sure if the person who submitted the Q&A can confirm that they understand that logic. That's the one part about a one-way webinar. I'll go ahead and move on to, it'll be 2 slides because we did go through the image description. So now we're going to move to the part of the discussion that is, what do I need to do long-term to continue charging indirect cost? We've talked about this a lot today, and that is having systems, policies, and controls in place that permit you to charge indirect cost. We've talked about the importance of sitting down and identifying direct costs versus indirect cost. And the reason you do that is so you can consistently charge the indirect cost rate on all of your federal awards, because you will know 100% of the time that you're using that rate in a consistent and planned manner. Also ensure that you have adequate capacity and that you have staff that's trained in the application of indirect cost. I have worked with several CILs where there has been turnover and they've lost key accounting staff or financial staff. If that was the only person within your organization that knew how to do indirect cost or manage indirect cost, then please take some time to reach out to another professional or obtain additional capacity to fill that gap, because you are at risk of not applying the right standards or methods to do indirect cost rate charging if you lack individuals who are knowledgeable on the topic. Next slide, please. Okay, I'm going to pause 1 minute. I see a chat comment from Michael, and it says, we receive state and federal funding under Title VII. The state portion we have, we've not been able to claim, right? So this is a federal indirect cost rate agreement, right? So it applies to federal funding. If you receive money from the state, you could use a federal indirect cost rate, de minimis or negotiated indirect cost rate, if the state funding derives from a federal grant. So a lot of times states will serve as a pass-through and send federal funds down. This is common in Part B for independent living. If it is truly state funds, then you would not be able to use a federal indirect cost rate unless there were state rules and laws and regulations supporting it.
The states are required though, right, Aaron, to use the rate for Part B funds that are federal pass-through funds. They would
Correct.
use that negotiated rate.
They should allow you to use the negotiated rate or to use the de minimis. I will say I've looked at a variety of subaward contracts and have seen that. Some of the language I worry about, or maybe the connotation I worry about in those contracts, is that they will say you can take 10% indirect cost and don't make a reference to the regulation. So someone might just think I'm taking 10% indirect cost or 10% admin instead of I'm taking 10% in line with the de minimis regulation and modified total direct cost.
Yeah,
So I haven't seen it. Yeah, sorry, go ahead.
There was a question in the Q&A that kind of reflects part of that. So the question is, are you saying the base always equals direct cost related to the FFR? Can't the base be different than the total direct costs? For example, the base can be salaries and benefits, which is not the total direct costs. In this case, the total charged would not be base plus direct.
Yeah, and that's a nuanced question, and I think that that's fair. When we went over in the early part of the presentation, it gave examples of common cost items that are part of the MTDC calculation. For some organizations, that's a very basic definition, and it could just be salary cost or salary plus fringe, and they don't incorporate a bunch of the other costs associated with operating a business. If that's how you set up your system and you're applying it consistently, that sounds reasonable, right? Again, this is an instance of if you have a negotiated indirect cost rate, PSC is the accounting professionals who can help you affirm that you have a correct plan and controls in place to do this charging. And if you really want someone to sit down and dig into your accounts, accounting professional would be the best one to work with you one-on-one and talk with you about your specific environment. But that is totally fair. There are a lot of nuances in how you go about that calculation. I see some other questions in the Q&A. I think we're at a point where we can go ahead and do some of those and then come back to the presentation. There's one that says, how do we handle the date range on the rate when the approving agency is a year behind updating the indirect cost rate justification proposals? That is a really good question. To be 100% in line with the regulation, you want approval on an indirect cost rate that gives you a time period and that you apply the rate for that specific time period. If your renewals are behind, I would do your best to get a confirmation from PSC, that our program support center or the other applicable office, that the review is in progress. And if possible, put a specific question to them that says, why my review is being conducted. Can I continue to use the most recently approved rate? In most of those instances where the grantee has been able to demonstrate that they took a timely action and demonstrated clear due diligence to obtain a rate renewal, then federal agencies have been open to allowing them to continue to use a previously approved rate. And this is usually within the first year after the rate would expire. So I would say these are some common standards I've taken from other agencies. And this really comes down to, again, showing that you're doing timely action and demonstrating proper due diligence. There is another question that says, thank you. We're working on a new proposal and our indirect costs have increased in the last year. I'm estimating that a new negotiated rate will increase over the expired rate. I'm glad that you took the time to go ahead and review your indirect cost. That's a great best practice to say, hey, we haven't done this in 3 years. Our organization has changed. We need to take a look at this again and make sure that the rate still works for us. Until that rate is approved, at least provisionally, you can't use it in effect yet. If you are able to get something in writing from Program Support Center that says otherwise, then I would be happy to be contradicted, but I would encourage you to wait for the approval before applying that new rate.
Aaron, there might be an exception to that. If their new rate is substantially less, you are allowed to charge less than your approved rate, and you might be wise to do that if you realize that what you were drawing down for your indirect costs was greater and now it's less. You know, you could certainly charge less than the approved rate, right?
Correct, right? The rate is the cap, so you can always take less than the amount. In this specific question, they were referencing an increase, but I'm glad you brought in the alternative is what if our rate is actually decreased, but because we've become more efficient here, or maybe we move to a new location and our lease is less, right? And we have less operational expenses. Thanks for bringing in the other side of that. And I'll just acknowledge the question that there is a state that has trouble understanding provisional versus approved indirect cost rate. If that's something that we need to work on from a designated state entity standpoint, I am your grant management specialist rep for Part B, all states across the country. So I'm happy to obtain a question, and I would always encourage you to send, some of these obstacles or challenges to your program officer in the Office of Independent Living Programs. I'm going to turn back to the presentation. We have a little bit more and try to get us through to the questions, and then we can come back to any chat or Q&A. Next slide, please. All right. And I know this is one where Paula's going to come in and help me on this one. I'll go ahead and set it up, and that is one of the common feedbacks or maybe misunderstandings that we get within the SIL community is administrative cost versus indirect cost. Today, we've spent our time talking about indirect cost, and it's important to be able to define your cost and bucket them as direct or indirect cost. In our discussion of the definition of indirect cost, one of the examples given for nonprofits was administrative cost, such as costs for administrative individuals, like an administrative assistant, a bookkeeper, or maybe an executive, right? Where these individuals could spend part of their time on direct award delivery, but might spend most of their time on activities that are not directly assignable to an award. So when you are looking at your own system and your own SIL, be mindful of administrative costs and what they really are, and start your analysis first with, is this a direct cost? Is it directly assignable to the award? Is it directly implementing award delivery or activity delivery, or is it an indirect cost?
Right.
And then you can step into administrative costs. And I'll gladly trade off to Paula for a little bit.
Well, and because salaries are your greatest cost, the place where you most often are measuring this has to do with your salaries of your administrative or partially administrative staff. And centers do this differently from one organization to the next. Some just say, the executive director is 100% indirect. And others say, no, the executive director's keeping a timesheet that says he or she is working on Title VII, Part C during this time, and Part B during this time, and the state funding during this time. And that leaves only a percentage left over that is actually indirect, because some of that time can be charged directly. This is also true with program managers often. So program managers often work with more than one funding source. Therefore, their time needs to be tracked so that it can be charged to the correct funding source. And some of their time may not be indirect. It may be direct. That's less true with financial staff. Typically, your bookkeeper or your other financial staff are 100% indirect because they can't separate out their time based on funding source because they're often working with the whole process. So often they would tend to be 100% indirect. Now, what are administrative costs? Often you will have indirect costs that would not be considered administrative because they're shared costs. So there's shared costs, meaning, all the stuff that we used to keep track of, with codes and things, you still can do that if you want to. So your copying machine and your office supplies and your other costs that are shared costs, if you have people checking out that they took 2 legal pads out of the supply closet, then maybe you really do want to keep track of this and charge them directly. But if that is more work than it's worth, make them an indirect cost, because indirect means shared. Right? Now, Erin, am I on track?
And I'll just add on, the indirect means not directly assignable, right? So shared is a good example. Or the burden of assigning them is so great that it wipes you out, and it's easier to pool them and put them all together.
So how you pool those costs is up to the center. That's what's in your plan.
Correct, right? So you should feel empowered in that way, that it gives you flexibility or autonomy, right? In how you set up your plan and define indirect cost. There are some regulatory parameters that we went over today that help frame examples, but even within those, there is significant flexibility. I'll track before we go to the next slide, Paula, because I know we're starting to watch time. Cynthia, I see your question in the Q&A. We'll come back to it at the end. Next slide, please. So we have a couple questions here, and I think I'll jump first, and then Paula is welcome to jump in. The first question is, if a SIL federal grantee only receives Part C funds and they direct charge all costs to their ACL grant award, is it appropriate to use indirect cost rate? Right. So if your grant is solely funded by your if your organization, your SIL, is solely funded by your Part C award, and you have little or no other funding coming in, you really have no basis to do indirect cost, because everything that you expend, all your expenses, are for the operation of the SIL. So in that instance, it's very unlikely that you would be charging indirect cost.
Right, so you have one funding source and only one. Now that's problematic on the program side, because you're required to do resource development. So you ought to have more than one funding source, but we're not talking about that right now. We're talking about if you only have one funding source and all of your costs are direct to that funding source, then that's how you would charge them, as directly rather than at an indirect rate. Right?
Yeah. Yep. And I did see another question just come in on the Q&A. We'll answer that one as well. There's a lot of good nuanced questions coming in today. I'm hoping our discussion is more than anything prompting you to think about this and think, one, okay, I've been doing it this way. Maybe I want to do some tweaks and try it a different way, or I've been hesitant to jump in to indirect cost. If I take some of the steps we've talked about today, maybe I'll feel more comfortable and start being able to do that. In most cases, when you start doing indirect costs and you feel confident about your understanding or definition of cost within your organization, it should really help with managing your overall operational expenses, back of house expenses, right? Because you will have a clear understanding of all of your overhead and what money you'll be able to take from a federal award as a fixed percentage to help offset that overhead cost. The second question we have is, can a federal grantee charge indirect cost if they use a cost allocation plan to directly charge shared cost? And when I initially wrote this, and shared costs on the screen, I gave examples: rent, utilities, IT costs, and et cetera. So a lot of other shared costs. Again, for indirect costs, the first way we look at it is it's not directly assignable to a grant award. A lot of times an indirect cost represents a cost that's shared either across the organization or across several offices within an organization. When I wrote this question, I was thinking about cost allocation plans from the standpoint of a state, because a lot of times the state will have cost allocation plans in lieu of an indirect cost rate agreement to help allocate costs towards shared services like accounting offices or marketing offices or HR offices that make the state run but aren't part of the direct service of the award. I would encourage every single SIL to have a cost allocation plan at an organizational level. And this cost allocation plan would say, for this cost, we either distribute it across all awards because it's associated with activity delivery, or we distribute this amount directly to awards, and this amount is considered indirect cost. We had an example in the Q&A about rent being a shared cost, and rent is often a shared cost. Depending on your SIL and how much revenue you receive, you might direct charge rent, and this would be directly charging the rent for most likely for an individual who's doing work on the award. You could do this from a square footage standpoint, or maybe you could do it from a time and effort standpoint. And in those cases, you could charge a portion of the rent to the award based on how much of your staff or how much of your facility is devoted to that award.
I think, Aaron, that this
yeah.
person also was asking about this in relationship to the de minimis, where
Okay.
rent can't be included.
Okay. Yeah. So that's, I guess, one of these
Nuance, yeah.
nuanced exclusions, right? I will say for most of the SILs, we see direct charging of the rent, either based on square footage, so how much of your facility is devoted to a program, or how much of your staff time is devoted to program delivery. That's a good question. So thank you for pointing
Yeah.
out the juxtaposition. I appreciate the feedback because it's hard to keep track of everything
Right,
within
and
45.
often when they're using the 10% de minimis, if they're using it properly, they would find a negotiated rate would be better, partly because of those rent costs. And then there's some salary costs that are limited too. And so as you said at the beginning, Aaron, often a negotiated rate is going to be more beneficial to the center than the 10% de minimis. And the exclusion of rent in the 10% de minimis is in the calculation is one of the reasons.
Okay. Yeah, and I apologize, Tracy. I see you have a question that says cost objectives can have their own shared cost or pooled allocation. What I would encourage you to take from this question on the screen about cost allocation plan is that your organization, like we said about direct versus indirect, should have a general cost allocation plan. And that plan within it should establish, is a cost direct or is it indirect, right? And the best example we've given of a cost that can be direct versus indirect is a salary, because you have salaries at all different tiers within your organization, and you have individuals that are salaried that do work that is inherently direct because they're IL specialists and they're providing direct services. Then you have individuals that are salaried that are focused on the management of the organization and non-direct delivery activities. So in that case, you have a cost item, salaries, that falls into different buckets based on what the individual is doing, right? Or what the position is doing. So the cost allocation plan is your overarching, this is how we organize our cost. Sorry, Paula.
How they're actually doing their time, though, is an important record keeping piece for justifying how you're splitting that time. So you have to have a document after the fact that says their time was actually used in a certain way in order for them to have to allocate that cost in that way.
Correct, right? And that's another way of looking at cost allocation. And I'm seeing is that might be a future discussion topic, and really diving into timesheets and work done, and actually equating work done with charges to an award, right? And to quickly sum this up, when you track time, you should be tracking time by the individual and their day, and specifically their hours worked on a project or an award. So by associating the hours with a funding source, you're meeting that minimum criteria, And then you should have a companion document, and this might all be in one system, that says the work that the individual did that day. And that's your supporting documentation that they were working the award and actually doing service that is directly chargeable to the funding source. So I'm going to keep us going on the presentation. We'll get through the best practices. Next slide, please. All right, so we did want to hit some best practices at the end around cost allowability reminders. We want you to ensure that your financial management policies and procedures are up to date and refer to the correct acts, statutes, regulations, and award terms and conditions. In reviewing SILs, it's common that I'll see 2 CFR 200 instead of 45 CFR 75. This might be okay if you have a variety of funding sources that include those that are under 2 CFR 200. But if ACL or HHS is your primary funder, then your uniform guidance references within your policies should be based in 45 CFR 75. Also, you should mention in your policies and procedures that you need to adhere to the Rehab Act of 1973, because the Rehab Act establishes the standards and assurances for a SIL, and that's important basis of how you use and manage funds under Part C.
And those regulations are also found in 45 CFR 1329, if that's helpful to people.
Thank you, Paula. That's great. The codified version is very helpful. Also, when you're managing your award, you need to know the assigned project period. I know this was a topic that came up in August, was a big talking point. This project period can be synonymous with the definition in 45 CFR 75.2 of period of performance. The most critical thing is that the project period is stated in your notice of award. It outlines the start date for funding and the last day to use funding. That last day is your last day to obligate, to expend the funds, and to implement the work. You can't do any more work on the award after that last day. For Part C awards, your last day is always September 29th. And this is an important definition, and I would remind everyone from a pause, this is the seriousness moment, right, of federal funding. Whenever you draw money from payment management system, you draw money on a new award, you are agreeing to the terms of that award. So this is a statement within your notice of award, the first one you receive, that says the award will be executed, including all terms and conditions when you draw funds from payment management system.
Right. And all of this is part of the answer to Cynthia's question, which has been in the Q&A here. We have somebody who receives more funding from another source rather than ACL. Well, you need to identify that and what the timelines are and how all of that works, and need to determine. But usually if it's another pass-through federal funding source, they will allow your approved indirect cost rate. So, but that's something you have to sort through individually, Cynthia. Unfortunately, we can't really say it has to be done a certain way. I would double check with that funding source. But if it's larger, Aaron, can they use the regulations from that agency rather than
Yeah,
ACL,
so
HHS?
we're close to wrap up, so we'll go ahead and hit Cynthia's question. So she has HHSC, right, in Texas, which is the state version of Health and Human Services within the Texas state government, and she's saying that's their largest funder. So these indirect cost rates we've been talking about today, you can only use on federal funds. If HHSC, so the state of Texas Health and Human Services, is giving you funding and it's federally based grant funding that's managed under 2 CFR 200 or 45 CFR 75, then you can use an indirect cost rate. If it's truly state funding and state assembly or legislature or general funds, then they don't have to permit the use of it. There would have to be a state law or rural regulation permitting a use of a federal rate. So in this case, that HHSC is your largest funder. They're not a federal entity. It'll be your largest federal funder, right?
They may be passing through federal funds though, so
Mhm.
it's
You would have
complicated
to,
question.
you'd have
with
to know the
nuance.
source of the federal funds. If your subaward agreement from the state is not identifying the source of federal funds, it should. So ask them, right? It should always say in your subaward agreement what grant number or what source contract number those federal funds are being provided through. I do realize, let's keep going the slides. Next slide, please. We realized this would be a robust discussion presentation, so I apologize for the stepping off the slides on occasion. There's been some really good questions and have wanted to try to engage those. So finishing up on best practices, we talked about strong policies and procedures and keeping them up to date. We talked about knowing your project period for your federal award. We've talked a lot today about having strong internal controls and updated accounting systems. Now we're going to finish it off with reminding, have supporting documentation for your award expenses. This includes procurement actions and contracting, your purchase receipts and your invoices, your payment approvals, and your expense approvals. Documentation to support federal expenditures should be maintained for at least 3 years from the date you submit your final financial report. So this would be the date you submit your final FFR, add 3 years onto that, and that's the minimum requirement under the uniform guidance. These are going to be really important to helping you justify expenses and making sure they're not only programmatically eligible, so permissible under the Rehab Act, but they align with the cost principles in 45 CFR 75. Last thing as a best practice, make sure you have an active board. Boards are super important to SILs. They give a necessary and critical check and balance to the organization. They help you to stay on vision and on mission, and they give good accountability full circle to make for a stronger SIL. Next slide, please. And I know Mary Kate, you're coming on because we're so close to finish.
I
And
guess
we're there.
one last question, or we just refer you to the evaluation link? Very good.
Yep. I know this was a robust, like you said, Erin, conversation, and I think there will be more questions. So the way we're going to end it is we would love your feedback on this webinar. The recording and all the material will be posted within a few days. And then Paula, I also wanted to plug the financial manager TA call, which I'm going to put in the chat. And that is an opportunity where you'll have some smaller time with Paula.
Yeah, it's a monthly call, so it's a
Yeah.
good call for this discussion.
Yeah.
And
So
Mary Kate, there was a yes or no question. Could I answer that real quick?
go for it.
So Charles had a question in the comments. If you originally had a cost allocation plan, and this would be like basically just a cost allocation strategy for everything on Part C, this is how I'm going to allocate it, you know, breakout, and then you switch to an ICR, an indirect cost rate. Yes, your indirect cost rate agreement or how you do de minimis would generally replace your cost allocation. Because within that plan or that agreement, you are saying these are my direct costs and how I'm doing them, and these are my indirect costs. So how you asked your question, Charles, in the comment, the answer is yes. Right.
Awesome. All right. Well, thank you so much, Erin and Paula and everyone joining today. Please give us some feedback on how today the webinar went. And, you know, we're going to still be here to, not right now, but, you know, we'll be around to provide some more training and technical assistance. So I hope everyone has a great day. Thank you.